Now that we have discussed the extrinsic muscles of the hand, which are very important in terms of the prehensile functions of the hand, now we're also going to talk about the intrinsic muscles of the hand, which are very important as well, such as the interossei and the lumbrical muscles. And when we talk about the dorsal aspect of the hand as well as the posterior aspect of the wrist, they also become important in their function. So in this context, we are going to talk about the intrinsic muscles such as lumbricals and the palmar and dorsal interossei. But we're also going to talk about some connective tissue structures such as the extensor hood and the extensor retinaculum. And we're also going to talk about the anatomic nerve box, which is formed by the different muscles, tendons in terms of their relation with each other, and they make an anatomical structure at the aspect of the dorsolateral aspect of the hand. So starting off with the bones and muscles attachments on the posterior or the dorsal aspect of the hand. So here we can clearly see that we have the red area, which actually shows us where the have the attachment sites for the interossei muscles. Similarly, we also have the lumbrical muscles, but they do not have a bony attachment on the dorsal aspect, even though they arise from the ventral or the palmar aspect, but they insert into the dorsal aspect. And because of that, they do not have a bony attachment, so we cannot see their attachment site here. Moreover, we can also see some other muscles such as the extrinsic muscles such as the extensor carpi radialis longus, extensor carpi radialis brevis, and extensor carpi ulnaris, which are actually the extrinsic muscles acting as the extensors and the ulnar and radial deviators of the wrist respectively. Moreover, we have also other muscles, extrinsic muscles, which are not acting at the level of the wrist but acting at the level of the digits. For example, extensor pollicis brevis, extensor longus, as well as extensor ditorum. Once again, we cannot clearly see the extensor ditorum because it inserts via the extensor expansion or the extensor hood. So that is why we cannot see it being mentioned here as similarly. So talking about the intrinsic muscles of the hand, first of all, we're going to talk about the dorsal interossei. But when we talk about the dorsal interossei, we're also going to talk about the palmar interossei in the upcoming slides. But dorsal interossei are more importantly because we're talking about the dorsal aspect. So there are 4 dorsal interossei. Now, starting off with the proximal attachment site of the dorsal interossei, it starts off with the first dorsal interossei. The proximal attachment is with the first and the second metacarpals, and the distal attachment is on the lateral side of the index finger. The action of the first dorsal interossei is the abduction of the index finger. Now, the abduction of the index finger is actually the movement of the index finger away from the midline. The reference point for this would be the middle finger. So for example, if I'm doing this is the abduction of the index finger. Similarly, talking about the second dorsal interossei, its proximal attachment is with the second and the third metacarpals, and the distal attachment is on the lateral side of the middle finger. Now, if we talk about the middle finger, there are 2 interossei which are being inserted into the middle finger. Now, the second interossei's function is the abduction of the middle finger laterally, which is towards the side of the radius, which is this function. So this is actually the abduction of the middle finger laterally, which is towards the thumb or towards the radius. The third dorsal interossei has its proximal attachment site at the third and fourth metacarpal, and once again, as already mentioned, it has its attachment on the middle finger, but this time it is on the medial side of the middle finger, which is towards the ulnar aspect, and the action is once again abduction of the middle finger but medially. So if I talk about the middle finger, this is the medial abduction and this is the lateral abduction. So as we say that the reference point is the middle finger itself, so if it moves towards the thumb or towards the radius, then that is because of the second dorsal interossei, and if it moves towards the ulna or towards the little finger, then that is because of the third dorsal interossei. And we have 2 dorsal interossei, the second and the third, which are acting at the middle finger. Then we have the fourth dorsal interossei, which has its origin from the fourth and fifth metacarpal. However, it is inserting, or it has its distal attachment site at the level of the middle side of the ring finger, which is this finger. And its action is once again in the terms of the abduction of the ring finger, that is when it moves away from the middle finger. And here you can see the dorsal interosseous muscles as well. This is the middle finger, and you can see we have the second and the third dorsal interosseous both inserting into the middle finger. The palmar interosseous are actually located on the palmar aspect, but still it's important to discuss them in context with the dorsal interosseous, even though we are discussing the dorsal aspect. And once again, we have four different palmar interosseous. So talking about the first palmar interosseous, the proximal attachment is from the first metacarpal, and it inserts into the medial side of the thumb. As we already discussed, there was no dorsal interosseous which had its attachment with the thumb. However, in terms of the palmar interosseous, one of the palmar interosseous, which is the first palmar interosseous, has its insertion at the medial side of the thumb, and thus it is involved in the abduction of the thumb. The second dorsal interosseous has its proximal attachment as the second metacarpal, and its insertion at the medial side of the index finger, and it is involved in the abduction of the index finger. The third palmar interosseous has its proximal attachment at the fourth metacarpal, and its insertion into the lateral side of the ring finger, and thus it causes the abduction of the ring finger. The fourth palmar interosseous has its proximal attachment at the fifth metacarpal, and its attachment at the lateral side of the little finger, causing abduction of the little finger. It is important to be noted that there was no dorsal interosseous having its attachment site with the little finger. However, there is no palmar interosseous which has its attachment with the middle finger. Now, talking about a very important connective tissue structure, which is the extensor expansion ligament, and it also serves importantly because it serves as an insertional site for the extensor ditorum as well as the lumbrical muscles. So, talking about the extensor expansion ligament or the extensor expansion hood, it is a small triangular shaped flat aponeurosis, and which covers the dorsum and sides of the proximal phalanx of the fingers, as you can see in this picture here. So this is actually the extensor expansion, and the proximal aspect of this is actually known as the extensor hood. And you can see that the extensor ditorum muscle as well as the lumbrical muscles and interosseous muscles are actually coming and inserting or blending in with the extensor expansion ligament or the extensor hood. So, as already mentioned, it is also called the extensor hood, and the extensor ditorum tendon blends into the extensor expansion, as you can see here, which is actually an extrinsic muscle acting as the extensor at all three joints of the first, second, third, and fourth finger, not the thumb, but the fingers. And it is wider at its base over the metacarpophalangeal joint and wraps over sides somewhat and then narrows down distally. Here you can see this as well. This is the extensor expansion. This is the extensor ditorum tendon, which comes and blends with the extensor hood or the extensor expansion and is broader proximally and narrows down distally. And you can see that the interosseous as well as the lumbrical muscles are coming and blending in with the extensor expansion or the extensor hood, or you can say inserting into the extensor expansion or the extensor hood. So at the level of the proximal interphalangeal joints, it is joined by the tendons of lumbricals and interosseous muscles as well. After it was being joined by the extensor ditorum more proximally, and it narrows toward the distal end, as I've already told you. The attachment of the extensor ditorum, lumbricals, and interosseous muscles are all in terms of the middle fingers and distal phalanx is due to this extensor expansion ligament. Thus, it is very important in terms of the prehensile functions and the muscular action. So hood area is actually formed by the extensor expansion, which covers the head of the metacarpal, where we can see that the extensor ditorum is actually coming and joining in with the extensor expansion or the extensor hood. Now, talking about the lumbrical muscles, because they actually insert into the extensor expansion or the extensor hood, so that's why we are discussing it after the extensor expansion ligament. And even though these muscles are actually present palmar aspect, but they actually move upwards and insert on the dorsal aspect. So that is why we're also going to talk or consider them in the dorsal aspect of the hand as well. So here we can see there, this is actually the palmar aspect, and here we have the lumbrical muscles which are actually moving towards the dorsum of the hand and inserting into the extensor expansion. So the origin is why the tendon or the flexor ditorum muscle and flexor ditorum profundus muscle, and the insertion is why the tendon of the extensor ditorum muscle. That tendon of the extensor ditorum muscle actually forms the extensor expansion, and they actually insert into that extensor expansion or the extensor hood. So if we look at the lumbrical muscles, they are actually not in having any bony attachment, but they have the attachment both at the origin and insertion side from the tendons of the other muscles. Talking about the action of the lumbrical muscles, the action is to flex the metacarpophalangeal joint while extending the proximal and distal interphalangeal joint. So that is why they are also important, because they make a specific type of grip which is known as lumbrical grip, because it causes the flexion of the metacarpophalangeal joint and the extension of the proximal and distal interphalangeal joint. And due to the paralysis or insufficiency of the lumbrical muscles, it is impossible to make a lumbrical grip. This type of grip is known as a lumbrical grip, and it is usually used to hold, for example, a book or a plate, etc. The nerve supply of the first and second lumbricals is via the median nerve, whereas that of the third and fourth lumbrical is via the ulnar nerve, via the nerve roots of C6, C7, and C8 nerve roots. So here once again we can see this is the extensor ditorum, which becomes the extensor expansion and the extensor hood, and we can see that the lumbrical muscles which are actually arising from the palmar aspect are moving dorsally and inserting into the extensor ditorum tendon or the extensor expansion. Another important structure that we would need to mention is the anatomic snuff box, which is actually formed by the tendons of the thumb. One is the extensor pollicis longus muscle on the medial aspect, and the abductor pollicis longus as well as extensor pollicis brevis on the lateral aspect. And if we take a look at this structure, this is known as the anatomic snuff box in terms of the superficial anatomy. And in terms of the floor of the anatomic snuff box, we have the trapezium and the scaphoid bones, which are actually carpal bones of the hand. Moreover, we have in terms of the contents, we have the superficial branch of the radial nerve as well as the radial artery lying on the scaphoid and trapezium in the snuff box. Just like the palmar aspect of the wrist and hand, we had the flexor retinaculum. Similarly, in the dorsal aspect, we have the extensor retinaculum, which is similarly a fibrous branch traversing the wrist on the posterior or the dorsal aspect in a horizontal mediolateral direction. So the function is that it holds the extensor tendons close to the wrist, thus not allowing the bowstring effect, and attaches to the styloid process of the ulna, the trochletrium, the pisiform, as well as the lateral side of the radius. Now here you can see that this is actually the extensor retinaculum. Here we have the radius and ulna, and actually which are the bony structures, and here we have the tendons which are actually beneath the extensor retinaculum. So those tendons include most laterally we have the abductor and the extensor pollicis brevis, which are abductor and extensor pollicis brevis, these one. The number two is the extensor carpi radialis and the extensor carpi longus, extensor carpi radialis longus and the extensor carpi brevis muscles. The third one is the extensor pollicis longus, which is the one here. Then we have the extensor indicis and the extensor digitorum, which are here. So extensor digitorum and extensor indicis. The fifth one is the extensor digiti minimi, which is this one, and the one on the most medial aspect is the extensor carpi ulnaris. So from moving on from the lateral towards the medial aspect, we have the abductor and extensor pollicis brevis, then the extensor carpi radialis longus and extensor carpi radialis brevis, then the extensor pollicis longus, then the extensor indicis and the extensor digitorum, then the extensor digiti minimi, and the most medial one is the extensor carpi ulnaris. And here you can see all of those muscles as well. Here we have on the lateral aspect, we have the abductor pollicis longus and brevis. Then we can see extensor pollicis longus, the extensor carpa radialis. Then we have the extensor indicis and the extensor digitorum. And then we have the extensor deepi minimi and the extensor carpa ulnaris. And here we have the extensor retinaculum. So that was all about the intrinsic muscles of the hand and the connective tissue structures such as the extensor retinaculum and the extensor expansion ligament, etc. And I hope you learned something new out of it. So keep on watching sqadia.com for more lectures like this. Thank you very much.